We were discussing about the treatment plan, right? So because of some internet issue, it was discontinued, but let's just start from here. So in case of treatment plan, we would be discussing the whole sequence of writing the treatment plan later, but now currently we will be going through the basics of the treatment plan just in case of our presentations, right? So, in case of your presentation, what you would be quoting about your short term goals and your long term. We have discussed about the concerning complaints that how they would be actually suggesting your long term. So, in case of short term goals, your visual analog or your client's ratings of the problem would suggest you that how you can actually suggest your short-term goals. All right. Then comes your case conceptualization. We have also discussed that it would be actually you can say the client's case information in the light of actually the projection of the whole theoretical point of view of the psychology. All right. That would be your case conceptualization. So you have to actually mention that as well. Then comes your case formulation. We have discussed what are the P factors that can be involved and how they would be actually projecting the whole case for you, just for the others' understanding and overall profile, right? Then comes the summary of the case. This is particular standard way to actually present your whole case and the steps for you to appropriately guide through. All right. Now, in case of treatment plan, how you can write a treatment plan properly, right? Not just like an article and you are just writing it like you are just grabbing the pencil and you are like, okay, I'm writing this. No, you have to make it presentable. All right. Make it something different. Sometimes you can say it's like something new. Everyone wears clothes. Everyone wears trouser shirts or either in the form of, the formal dressing or in the form of shalwar kameez or in my culture sometimes abaya or gown, right? But what makes you more presenting, what makes you more graceful, right? So there should be some kind of masala, some kind of spices you can do in your overall appearance. So in case of writing, formats do the same thing, right? So here is how you are going to write a treatment plan. First of all, the client's name, because it's going to be always remember any kind of treatment plan for any kind of disorder is individualized treatment plan because it would depend on your client's presenting complaints, his risk factors, his long terms and short term goals. That would help you to identify what type of theoretical approach and what type of theoretical intervention would be more suggestible for that particular client, right? So here comes his presenting complaints. Always remember to write the presenting complaints of the client as per his verbatim. All right. Then comes all the tests you have administered. Here you would write the names of the tests because you have mentioned the whole psychological evaluation in your case report already. Then comes the tentative diagnosis. All right. Then comes the goals of the therapy. Either they are short-term goals, then the long-term goals. All right. Then the main therapies. Just name of the main therapy. Whatever you have done, it would be on your part. All right. It should be in your mind. It should be his whole mechanism of every technique should be known to you because you have performed that, right? In the initial phases, whatever you have done will be right here. Then comes the middle phases, or you can say the intervention uh, phase of the client would be stated. Then comes the, unfortunately, there is some kind of error in the internet server today. So there can be some kind of miscommunication going on. So let's just not get worried about it. All right. It's just all right for actually having some kind of problems in your life. because you are not living an ideal life. All right. In this world, there is no life that can be stated ideal. You should have some kind of problems going on. All right. Then comes the middle phase we were talking about. That is basically the phase, or you can say the um, time duration where you have performed different psychotherapeutic approaches on the patient, or you can say the complete treatment you have actually done for would be stated in the middle phase. All right. After that, when his problems are being resolved, all right, and he is ready to go in his practical life again, all right, in that case, you would have to enter the whole therapeutic process to the terminal phase. All right. So in the terminal phase, you are going to mention whatever the worksheet, whatever the blueprints you have guided him to work on in case of your absence, because you are not going to be with him all over the 24 by 7 or all over his life. All right. You have to make him live like you have taught him, right? You have guided him to right now. So in that case, you are actually training the person to overcome his problem barriers in that setting. And now you are launching him again in the war of the world. All right. So you are just giving him some manuscripts, some blueprints to work on later in his life. And in case if he's having some issues, he should have some follow-ups over the period of time, right? So it would be stated here in the terminal phase, right? Then comes the number of sessions you have planned and you actually have done. So each number of session in case of initial sessions where you have done your clinical interview, where you have taken the history would be stated there. Then the number of sessions you have done overall in your middle section will be mentioned. Then whatever the time you have taken, sometimes you may have to take 3 to 4 terminal sessions for the patient because the client has been so in-depthly involved in the therapy that he don't want to terminate the whole process. So you actually have to make him acknowledge about the war of the world. All right. You have to get him ready for the launch, right? So that would be your terminal session. And it would depend on the client. Sometimes it takes just one session, sometimes it took around more than the 3 to 4 sessions. All right. Now, till right now, if any one of you have any kind of question, you can just mention it in your chat and I'll read it out. Now here is the patient log forms. Sometimes in different institute, there are different formats to record the daily processes of the clients. But most probably, it's been recommended in the clinical setting that you have a complete standardized log form for each patient. All right. And now in this current environment, it's been only on the CMS of different institutes to log each and every client's details. All right. So here comes for the education reasons that you can actually do the identifying information. Then comes the date of the session, the number of session you are being conducting right now, either it's first, second, or third. Then comes the nature of the session. All right, either it's all right, you can take the recording of every course, every program, every lecture on the YouTube channel of our clinic. That is the Minds Clinic. All right, you can search on the YouTube or I'll share the link later and you can just subscribe the channel. All right, and share them with others as well because as per our format, I don't think so. I haven't seen anybody working to be like this. So it would be very helpful for the students to learn it this way. All right. So let's get back to that. First of all, you are going to mention the session number you are working right now, either it's first, second, third, all right? Then comes the nature of the session. What is the overall nature of the session, all right? Either it's your clinical interview or your history taking, either it's your assessment session, either it's going to be your ongoing or therapeutic sessions, all right? either it's all right, either it's going to be, the a terminal session. So whatever it is, you have to mention the overall nature of the session for the records. All right. Then comes his current issue of the session. All right. There would be some issue na, that would be concerned one for you or for the patient that he wants to work on. So that issue would be suggested here. That particular issue you are going to work in that particular session would be suggested here. All right. And your key outcomes, whatever your work have you done in the previous sessions or in the current sessions or your assessment. So whatever the records have um made the output for you, you have to mention that there. If there is something unique happened, like in his behavior or in his the performance, you can state that. All right. So here comes the whole